On June 5, 1981, the Centers for Disease Control and Prevention published an innocuous report on a discovery by Dr. Michael Gottlieb of 5 young, otherwise healthy homosexual men who had mysteriously contracted pneumocystis carinii, a form of pneumonia. No one realized at the time that this was the beginning of a disease that would go almost unchecked for years, killing thousands and forever changing American culture by shifting the acceptability of homosexuality and by opening new doors for public health discussion: acquired immunodeficiency syndrome, or AIDS.
AIDS is caused by HIV, or the human immunodeficiency virus, a retrovirus that weakens a person's immune system so that he or she can no longer defend against other diseases. Victims of AIDS die from other opportunistic infections like pneumonia or cancer. In the early period of the epidemic, an AIDS diagnosis was literally a death sentence. However, it was often overlooked.
When you compare it to other maladies like swine flu or other mysterious, seemingly out of nowhere incidences of disease, and to see what kind of media attention they get, what kind of resources are devoted to them, and compare that to AIDS, it seems that something is amiss, and so it seems like homophobia is likely the culprit.
It was, first it was called GRID, gay-related immune disorder. I mean, it was called the gay plague, things like that.
AIDS spread quickly through urban gay communities, largely because of Gaetan Dugas, patient zero of the AIDS epidemic. Dugas was a flight attendant who frequented bathhouses in various urban locales and infected many other men with HIV. Bathhouses were essentially sexual watering holes where gay men went if they wanted quick, one-time sexual encounters.
Here in San Francisco, we had the huge bathhouse controversy. Okay, if AIDS is sexually transmitted and sexual activities going on in the bathhouses, should we close the bathhouses to stop that sexual transmission?
When it first emerged, AIDS was ignored both within and without the gay community. Mainstream American culture marginalized and often condemned gay men, and as a result, many gay men themselves refused to recognize AIDS as a legitimate threat, often dismissing it as another form of discrimination against them.
Even more, the CDC was poorly equipped to research these mysterious deaths. When Ronald Reagan became president in 1981, he cut funding for the CDC from $327 million to $161 million. As a result, the agency was unable to gather sufficient researchers and lab equipment to tackle the epidemic.
There's no interest, and I think it has to do with who has it. People that are seen as not valuable by the broader and dominant culture, people who live on the margins, socially stigmatized people, poor people.
Finally, in 1984, AIDS was brought to the awareness of the public eye when Ryan White, a 13-year-old hemophiliac from Indiana, contracted AIDS from a blood transfusion and was banned from school.
I can see where they're worried. But I mean, if my doctor says it's okay to go back, I don't see no reason why I can't.
White's case quickly gained publicity, and he and his family worked to raise awareness about the disease. Ryan White was not the only AIDS victim to draw the attention of the American people. On July 25, 1985, it was publicly announced that celebrity actor Rock Hudson, who had long been hailed as the epitome of masculinity and good looks, had contracted AIDS. This news also confirmed longtime rumors of Hudson's homosexuality. Hudson's AIDS diagnosis shocked the American public and brought much-needed attention to the AIDS epidemic.
Later on, in 1991, basketball star Magic Johnson also announced that he was HIV positive.
Because of the HIV virus that I have attained, I will have to retire from the Lakers today.
Johnson became a prominent spokesperson for the campaign against HIV, and his HIV-positive status was a wake-up call for many Americans who had until then believed HIV/AIDS to be a disease irrelevant to their own lives.
With this growing publicity, the HIV/AIDS scare began in earnest.
The lifestyle of some male homosexuals has triggered an epidemic.
The American public instinctively recoiled from any chance of contracting AIDS. Many people stopped giving blood donations out of misled fears of getting AIDS from giving blood. Even more, some states try to pass legislation that would have isolated AIDS patients, such as Proposition 64 or the LaRouche Initiative in California, which would have allowed the government to hold people suspected of being HIV positive in quarantine camps.
The fear surrounding AIDS also changed the way that Americans acted around the topic of sexual activity.
Before AIDS, there was the sexual revolution, and people were experimenting with different kinds of sexual expression.
AIDS put an end to the sexual revolution and forced people to reconsider their sexual behavior. When the Reagan administration finally recognized AIDS in 1986, the U.S. Surgeon General C. Everett Koop published articles to spread awareness about AIDS and emphasized education about safe sexual activity.
Sex has always been pretty much a taboo subject, so we might do it, but we don't want to talk about it, or we don't really want to think about it, or it just happens.
AIDS turned sexual behavior into a talking point in public health. From this point on, schools would begin teaching about having safe sex. People would see celebrities advocating safe sexual activity, and the American public would be more cautious in approaching sexual behavior as a whole.
Despite all the deaths that it caused, the disease was also an important catalyst in the gay rights movement.
You sort of had to come out and say who you were, and I think that might have inadvertently, in a really twisted way, helped the gay and lesbian rights movement, because people couldn't remain closeted because their lives were at stake.
Activism surrounding AIDS has had a direct impact on the way that the lesbian, gay, bisexual, and transgender community is perceived today.
Say what you need to say. Say what you need to say. Say what you need to say. Say what you need to say.
AIDS has left a permanent scar on American society.
Writers dying, artists dying, friends dying.
To have survived that with our sanity intact is a miracle.
But it has also completely changed the way people think about sexuality, cooperation, and acceptance. Whatever happens in the future, we will never be able to bring back the thousands who have died. But we can carry with us their memories and the lessons they have taught us.
They would not have lived in vain. We would not have gone through this experience as a community, my community, in vain, if we can put to use what we learned from it. That access to health care and freedom of expression based on what color you are, or what gender you are, or how you love, or whether or not you have insurance, for God's sake. If we can change that, if we can in any way transform the circumstances of human prejudice that increased human suffering during that time, then we will have vindicated their loss.